and take it away.
All right. Thank you, Amanda. Can you hear me okay?
Yes.
All right. So, and thank you everybody for joining us on this this Zoom webinar. So just to show you where I'm zooming in from. So I live in Missoula, Montana, which is west central Montana. This is pictures of Missoula. So it's the city is about 100,000 residents, give or take, in our area. There's just a little over 1 million people in the whole state, and so outside of Missoula, it's actually kind of rural and lots of trees and lots of forests around our region. And at the University of Montana, we have approximately 10,000 students, give or take, and I'm in the public health program at the University of Montana. So today I'm going to talk a little bit about, I guess the ultimate goal is to talk about some things that we could tell people once there's forest fire events and we're getting smoke in downwind communities. You know, the question always comes up is, what do you tell people to enable them to protect themselves from being exposed to wood smoke? So before we get to that point, I'm going to just back up and talk a little bit about, forest fire smoke and the chemistry of it and the health effects, and then we'll give a couple of case studies and show some work that we've done here in Missoula and looking at both outdoor exposures and also maybe more importantly indoor exposures during forest fire events. So when I travel and I tell people that I study air pollution, I live in Montana, they kind of look at me funny. They think that there's no air pollution in Missoula, but we do have air pollution. It's just a little bit different. We have the common sources of cars and trucks. We used to have more industry. We used to have a pulp mill here in town, and we have more wood products industry in the valley, but that's kind of dried up over the last decade and a half, a couple of decades. But we still have some industry in our area. Our sources of air pollution are a little bit different in that we have a lot of dirt roads in some areas. In late summer, they get very dusty and can generate particulates into the air. But really, our primary sources of air pollution throughout the year really are biomass burning. And during the winter, where we do a lot of research focused on residential wood stoves and understanding the exposures that people can have if they have a wood stove within their home, and then make recommendations on ways that they can protect themselves from those exposures and look at interventions and see if we reduce levels of wood smoke, how does it improve their health? So that is a majority of our work and research. But our other sources of air pollution that are related to biomass smoke or burning, during the fall and spring, we have a lot of slash burning in our area. And then during the summer, we're starting to see more and more impacts from regional forest fire smoke. So just a little bit about the chemistry of smoke and this kind of influences why it's harmful to downwind populations and folks fighting fires. So the wildfire smoke is composed primarily of carbon dioxide and water vapor, but there are some other nasty chemicals in it. Carbon monoxide is found in it, formaldehyde, polyaromatic hydrocarbons, benzene. Really, the main pollutant of concern, though, is the particle phase, the particulate matter, and about 80 to 90% of the wildfire smoke by mass is within this really small fraction called PM 2.5, and PM stands for particulate matter, and the 2.5 is essentially the size of the particle. And if I were to chop off one of my hairs or take one of my hairs and chop it in two, it's about 60 microns or micrometers in diameter. And these little particles that are found in forest fire smoke are very, very small compared to human hair. And that has implications when you breathe it in. Larger particles get caught up in your body's natural defense mechanisms, your filtration unit within your nose, with your nose hairs, but these very, very small particles that compose forest fire smoke can make it all the way down deep into your respiratory tract when you breathe them in, and it's because they're so small. we've done some studies in the past and collected particles and wood smoke particles and looked at it under a high-powered microscope, and this is what it looks like. And for scale, from here to here is 1 micron in diameter, or 1 millionth of a meter in diameter. So the problem comes in when you have large populations downwind that are exposed to elevated levels of wood smoke over extended periods of time. And when we look at, what is it about the smoke that's hazardous to you? Well, it's not so much the carbon dioxide or the water vapor. The CO2 has low toxicity, even though it's a major component of wood smoke. That's not the hazardous part of it. Carbon monoxide is, depending on where you are to the fire source, that's a little more of an immediate issue. But when we're talking about, downwind effects, it's really the PM 2.5 fraction that's of concern. And, like I said, there's lots of other stuff that's in forest fire smoke, but because it's really in such low concentrations, it's not too much of a health concern, especially in downwind populations. So it's primarily, the concern is these particulates, especially the PM 2.5 and smaller. Now, there was a really great paper that was released a couple of years ago, a critical review of health impacts of wildfire smoke exposure. So a lot of smart people looked at a lot of studies and kind of summarized this list of what are the accepted and peer-reviewed health effects from breathing in forest fire smoke over periods of time. So what they summarize is that there's associations with between forest fire smoke exposure and respiratory health effects, including exacerbations of asthma and COPD, or chronic obstructive pulmonary disease. There's growing evidence that there's association with increased risk of respiratory infections and all-cause mortality. When you look at heart disease, or cardiovascular effects, there was kind of mixed messages in the literature or in the different studies, but there is some suggestions that there's a link with cardiovascular disease. And then when we look at what type of population or subgroup is men, women, old people, young, what are the most acceptable group, and there was really insufficient research to answer that question. One thing that was really cool is they talked about the mental health effects, and just anecdotally, we had a really bad fire season a couple of years ago, summer 2017. And when you're in smoke for extended periods of time, and they're closing down the backcountry, and you can't go backpacking, and that's why we live in Montana, for the outdoors during the summer, and they start closing down the backcountry, and there's a real mental health component. People walk around and they're kind of they're grumpy, and when you look at the results from this paper, there's been studies that have shown that there's actually PTSD, post-traumatic stress disorders. Folks are depressed, they're anxious, and other phobias are linked with forest fire smoke exposure. So it makes sense, living through that. So just to point out that, EPA that regulates, we're talking about outdoor air pollutants, they only regulate, 6 major criteria pollutants. The ones that are related to forest fire smoke primarily are carbon monoxide and particulate matter. And there's 2 different sizes of particulate matter that are regulated. There's the larger particles, the PM10, but the PM 2.5 are the ones that we're most concerned about. So, by definition, there's regulations that are meant to protect populations from breathing in high levels of PM 2.5 because they cause adverse health effects. The annual standard, or the daily standard, or 24-hour standard for PM 2.5 is 35 micrograms per cubic meter. And we'll talk a little bit more about what that means in just a couple of slides. Now, we all know that wildfires are, they occur naturally. They've been here long before people have been here, and they occur naturally, and they have a place in our ecosystem. It's a natural thing that happens. And, in looking at this map, it happens a lot in the western part of the United States. especially in the Northern Rockies where we're located. There's, we know about the immediate dangers. There's loss of property, loss of life, homes burning down. But there's also that concern about, what happens if smoke is impacting downwind communities for extended periods of time. That could be literally thousands and thousands of people that are being exposed to hazardous air. I've seen one statistic that said worldwide it's estimated that 339,000 people die each year across the world due to the effects of wildfire smoke. So that's a pretty high number. So wildfire smoke it is part of our life here at least in the Western United States. The reason is you can get a fire that starts hundreds of kilometers away, and it will impact your community. And oftentimes we'll get smoke from Washington, or we'll get smoke from Canada, and we like to share our smoke with other states too. It starts here in Montana. But point is that you can have be impacted by smoke that's generated from a long way away. And again, this PM 2.5 is these particulates that we're most concerned about, especially in the downwind populations. So we'll switch gears and talk a little bit about the impacts on indoor air quality. Most folks they feel that you can see the smoke outdoors, and that's where if you go outside, that's where you're going to get exposed. But really, I think a lot of people don't understand that when you are indoors, there's a significant chance that you could be exposed to smoke indoors. So we've done a few studies over the years, and I'll present some of the data that we generated from those studies. This is a study we did back in 2011. We were actually hired by an insurance firm that there was homes that were making claims. They wanted to be cleaned up, and so we were working for this insurance agency to collect data inside of these homes, just to demonstrate that they were exposed, or that they did have smoke within their homes. So this is the Lost Conscious fire, way back in started June 26th, and then burned through August 3rd, 2011. And this was one that was right there by Los Alamos National Labs, and you might remember that from back then. It was kind of a scary thing, but it was a huge wildfire. It burned 160,000 acres, and it was one of the largest fires in state history. And it really started and generated lots of smoke and impacted downwind communities. So we were hired to collect wipe samples within 64 homes located downwind of the fire. So we went into people's homes, and we collected some wipe samples from basically dust samples, and then we analyzed it for char and ash, both indicators of biomass smoke, and then plotted that information on a Google map, which I'll show next. What it showed was that 78% of the homes that we sampled in downwind of the fire, we saw char was detected in the homes. We never saw ash within the homes, but we did see char in 78% of the homes. So here's where the fire was, and here's all the downwind locations that we collected samples. And kind of walk you through it. The green is the homes that we didn't see anything inside. No char, no ash. The blue had anywhere from 1 to 4% of char detected. Yellow is 5 to 9%, and red is 10 to 30%. So essentially, green is clean, and red had the most concentrations of char detected. So this just demonstrates that there was wood smoke within the homes, even up to 50 kilometers away from the fire. So that was in New Mexico, and then fast forward to a couple of years later here in Missoula. So like I said, a lot of our research has to do with sampling during the winter months, and we sample in hundreds of homes with these dust tracks, these little continuous PM 2.5 monitors, just to get an understanding of what folks are being exposed to inside of their homes when they have a wood stove. And so during the summer, this is kind of our time off, but we had a fire that started in our area, and I can't even remember which one it was. But we stuck one of these dust tracks on the roof of our building and then one in our lab, and let it run for a 3-day period in late August 2015. And the blue is the PM 2.5 concentration over this 3-day period, give or take. And then the red is the indoor concentrations. So that there's clearly a correlation between outdoor air and how it impacts indoor air. And when we look at the outdoor levels, it was about 170 micrograms per cubic meter over this period of time. That's the average concentration. And you see spikes all the way up to 400 outdoors. Indoors was the average was 124 micrograms per cubic meter with spikes, sustained concentrations between 250 and 300. And 75% of the outdoor air, our particulate matter, is what we were seeing or what we were measuring indoors. And this is in an indoor environment where there's a whole building full of people are being exposed to over this period of time. And just for reference, that National Ambient Air Quality Standard for PM 2.5 is the standard is 35 micrograms per cubic meter, just to kind of let you, give you a point of reference for what these numbers mean. So fast forward to a couple of years later in 2017, and this was, an especially bad fire season in the West. There was approximately 50,000 wildfires that burned. More than 3.4 million hectares. This was 2017 was one of the most expensive firefighting years on record for the U.S. Forest Service. Over $2.4 billion were spent on fighting fires. And if you remember, this was when that big fire in Northern California that started in October. It burned over 245,000 acres, destroyed almost 9,000 structures, killed 44 people, 192 injured. So it was a huge destructive fire season in general, particularly in Northern California, but also here in Montana. We had some pretty significant fires burning all around us in late August and in late summer, early fall. 21 large wildfires, 1.3 million acres burned. 2017 was the second biggest fire season on record in the Northern Rockies, surpassed only by the summer of 2012, which is just a few years earlier. And it was the most expensive fire season here in Montana, with $74 million spent on fighting the fires. So we had two that in particular were really bad for us, that really impacted our area. One was just right outside of town in Lolo, Montana, which is, if you've ever been to Missoula, it's just south, about 10 miles south of the city of Missoula. And just a little bit south of that was a big fire called the Lolo Peak Fire. It started July 15th and burned about 54,000 acres. Started July and ended in October. So whenever it snowed, that's when it finally went out. And then a really big fire, the Rice Ridge Fire, which started July 24th, burned over 160,000 acres through October, and at one time was the nation's top wildfire priority. So throughout Montana, we have a lot of these monitoring stations that our Montana Department of Environmental Quality runs. And there's this is one that's in Missoula, it's the Boyd Park site, and on the top are a variety of different PM 2.5 samplers, filter-based, and also some continuous monitors. And there's a network of these particulate matter samplers or monitoring stations throughout the state that DEQ maintains. And these continuous monitors, they can upload the data, and you can click on any one of these sites, and here's where Missoula is, right there. And when you click on that site, at any time, basically there's an hour lag, you can click on the site and you see something that looks like this. So this is the PM 2.5 concentrations over a 24-hour period, our averages over a 24-hour period. And just to walk you through the different categories. So this is a 24 hours starting at midnight and ending at midnight, hour-long sampling events or sampling averages. The green is good air quality, yellow is moderate, orange is unhealthy for sensitive groups, and what we mean by sensitive groups are the young, the old, the elderly, and those that are sick, whether they have asthma or heart disease or other illnesses like that. So there's 3 different sensitive groups that's what that represents. Red is the unhealthy, purple is very unhealthy, and then this dark red is hazardous air quality. So this is really the last 4 or 5 days of the Missoula fire season. So this was after a month of just being in, unhealthy air, and the wind would change sometimes, and we would get good air, and then all of a sudden it would just sneak back in, and we would be in really crappy air for days on end. So like I said, it had this physical component, but it also had this mental component where it seemed like the fire season would never go away. So this was kind of the last big smoke that we had over the summer of 2017. And I'll run through a couple of slides. So this is September 6th. So school had already started back, summer was over, and it was almost like fall. It was cooler temperatures, but we still had smoke. So it's September 6th, September 7th, unhealthy air. It dipped up into very unhealthy air, and this is here in Missoula, measured by those air samplers that I showed you. September 8th, so again, unhealthy and very unhealthy air. And then this was a Saturday, so Saturday, September 9th, and this was our last smoke day of the fire season. And it started out just like a normal day, like previous days, but that late afternoon, it actually rained for the first time. So a front blew through, got real windy. It actually rained a little bit, not a ton, but enough to knock down the fires. And as of that day, at 5 o'clock in the afternoon, and on September 9th, that was the end of our fire season. So the next day had a lot lower concentrations, and then it was better the day after that. So that was the end of our fire season. During that period of time, we also had deployed a lot of these dust tracks in several locations throughout Missoula. We were interested in measuring what folks were breathing inside of different businesses and schools throughout Missoula. These are 4 locations that I present data on for September 7th. So this is one of the days this is a very representative day of unhealthy air that was outside. So within a children's play area, so this was the Children's Museum here in Missoula. So kids come in and they it's a little museum. They play and color and do some other things. But the average concentration was about 93 micrograms per cubic meter over that period of time, this 24-hour period of time. There was a business office. I can't remember which one we sampled in, but close to 45 micrograms per cubic meter. A health club, 62 micrograms per cubic meter, and that's important because people are exercising and they're breathing in more forcefully and taking in deeper breaths and more volume of air. So that's important from that point of view. So high concentrations inside of the fitness club, and then one of the local high schools we measured 111 micrograms per cubic meter over that 24-hour period of time. So, for reference, again, there's no indoor air quality standard set by EPA. So this is the ambient air quality standard, but just for reference, all of these measurements that we took over a 24-hour period averaged over this 35 micrograms per cubic meter. So it just demonstrates that, it was pretty significantly, unhealthy air inside of these buildings, no matter which one that we looked at. So I'll talk a little bit about Seeley Lake, Montana. So this was a little community just north and east of Missoula. It's a small community. It's a little resort community. During the summer, there's some lakes, Seeley Lake, and it's a really great place to fish and hang out for the summer. During the winter, it's great for cross country skiing. So a small community, about 2,000 people. And, when we click on the monitoring site there and look at that data, this is what it looks like. And, this is that same period of time, the September 6th, September 7th, September 8th, September 9th, and again, it rained, and that was kind of the end of the fire season there. But in Seeley Lake, they were in hazardous air quality, and actually, for most of the time, you could see there's this gap. It's because there's, it went way off the charts as far as the amount of wood smoke that people were breathing over that summer. And when they retrospectively look back, there was 35 continuous days of hazardous air quality that population breathed in during that period of time. So, a large population exposed to significantly hazardous levels of poor air quality over, that long period of time. So it was kind of a worst case scenario up there. It was, we felt terrible for the folks that lived up there. Now, we did have an indoor air monitor that we had running. However, one of the days the fire made a run, and that part of the community had to be evacuated. So we never got that. The monitor didn't burn, but the battery went out, and we weren't able to collect any data. But I would suspect that if we looked at the indoor quality levels of that monitor, it was probably off the charts too. All right, so during these smoke events, especially being the public health program, we get lots of calls, asking, is it safe for our football team to go practice outside? Because that's beginning of football season and soccer season, and school starting up. So people want to know, are kids safe inside of schools? People with breathing problems call us all the time and ask, what do we do during these smoke events if it's really bad outside? Luckily, there's tons of great information that's already out there, and these are just some of the more comprehensive guides. EPA has put out a guide for public health officials. CDC, or Center for Disease Control and Prevention, has put out this nice this website, Protect Yourself from Smoke. Canada, BC has some really great materials with the link there that guides their public health officials in Canada, or at least in BC. Here locally in Montana, there's a really great website for Montana Department of Public Health and Human Services. This is our state health department. Washington State has some really great materials, as does Oregon. Here in Missoula, we have a little nonprofit called Climate Smart Missoula, and they've generated some really amazing materials that they can pass out. There's a website and they pass out information to schools and to asthmatics and the senior citizen populations. In this past 2017 fire season, they disseminated a lot of air filtration units to the people. So they do a lot of great work. So that's the website for them if you want to check out the materials that they have. So what we tell people is, basically, and what the health department's primary message is, limit your exposure outdoors. So don't go outdoors. Pay attention to local air quality reports. So I showed you the DEQ site where you can click on that dot for the city, and it brings up the current PM 2.5 concentrations. So you can kind of get a feel for what the levels are up to an hour ago. So it's a really great website, and everybody here in Missoula, including students, everybody goes to that website and looks at air quality during these forest fire events. And again, the message is reduce that activity outdoors, don't limit your exposure outdoors, but then and to stay indoors. But the important thing is to have an understanding that just because you're indoors doesn't mean that you're not being exposed to wood smoke. So that is a really important message that we try to tell people also, and that our Missoula Health Department tries to tell people, is that even though you are indoors during a smoke event, it doesn't mean that you have clean air. So we also tell people, and the health department tells people, limit your exposure sources indoors. So during forest fire events, try not to fry food, or burn candles or incense or smoke or vacuum or dust, anything that could potentially generate particulate matter inside of homes during these events. You want to try to limit that. Keep windows and doors closed. which is a problem here in Western Montana. When we moved here in the mid 90s, most people didn't have air conditioners. And even though it would be, we would have like 1 week of really hot weather during the summer. And, if you just got through that, you could always open your windows at night and cool off. But now it seems like the summers are a little bit warmer, and it doesn't cool off as fast as that used to at night. So if you don't have an air conditioner, you tell people to close up their house, and basically you're sweltering throughout the day. And if you can't open your windows at night, then it's a really terrible thing to experience. So you either open your windows and get cool and you're breathing in smoke, or you keep your windows closed, or tighten your house if you can, and you're sweltering. So it's a terrible trade-off. We finally broke down and got an AC 2 years ago, so, and are very happy about it. But if you do have an AC, use it, but keep your fresh air intake closed. Keep your filter clean, and that prevents outdoor smoke from getting inside. If you don't have an air conditioner, it's too warm to stay inside with the windows closed. A lot of these communities now have clean air shelters, or community clean air shelters. So these are places that you can go that have really great filtration units, or filtration systems that are designed to keep the air clean within buildings. So that's something that we're seeing more of here in Missoula. You can do something like that similar, take that same concept and do something like that within your own home, like an inner room that has no windows. You can kind of barricade that room, run some air filtration units. And this really pertains to the folks that have breathing problems, just to go in there you don't have to stay in there the whole time. Just go in there just a couple of hours a day just to get a break. And so that's one thing that we're starting to see more of, are these clean rooms within people's homes. Then I mentioned these clean air shelters. Now we've done a lot of, like I said, research with residential wood stoves and testing out different interventions as a way of reducing levels of wood smoke within homes to see how it improves the health of different populations, anywhere from babies all the way up to elderly populations, looking at different physical health effects. But these filtration units are one thing that we've used in many of our studies, and what we see is that when you use one of these filtration units that you can buy at like Walmart for $120, or Target or something like that you get pretty significant reductions in PM 2.5, and anywhere up to we typically tell people you'll get about a 70% improvement in air quality if you use one of these filtration units inside of your home, or 70% reduction in PM 2.5. And it also knocks down those spikes that you see, especially if you have a wood stove and anytime you load it, you stoke it, you get that big spike within your home. So these filtration units, running one of these filtration units like this, and there's tons of different varieties that are out there on the market. I don't even know if 3M makes this particular version anymore, but there's tons of different brands out there, and they all work pretty well. Especially if it's a filter, you don't want to get the ones that generate ozone. But these filtration, portable units work really, really well. And then for the folks that go outside with surgical masks or dust masks or the bandanas, the bandanas may look really cool, but they don't really work very well in reducing levels of your exposure to PM 2.5. There are specific masks that you can wear, these N95 disposable particulate respirators. They're designed to cut out these smallest particles. And and once during the fire season, our local hardware stores and really stock up on these respirators. They work pretty well. Back to Cedar Lake, this is the response to the community from the Missoula Health Department. It is the first time that I've ever seen a health department tell the community to basically don't spend any time in the community. Again, this is a small valley location. The fire was just right outside, or right up the mountain from Cedar Lake, And again, they had 35 days of hazardous air quality. So the health department was telling them, spend as little time as you can in Cedar Lake. So that was the first time I've actually seen that message from a health department to a community to basically get out if you can. Looking in the future, this is not a problem that's going to go away. This is something that I think is here to stay because of climate change and some other factors. But just to point out, looking at this past fire season in California, there was some really terrible fires that happened. The Car Fire that burned, 230,000 acres. Residents burned. 503 outbuildings destroyed. 3 firefighters and 5 civilians actually died. The next one, the Mendocino complex. 460,000 acres, lots of buildings destroyed. Firefighter killed, 4 firefighters injured. And then the really big one, the Camp Fire, which was the deadliest, most destructive wildfire in California history. 5 firefighters injured, 86 deaths, 12 civilians injured, 3 civilians are still missing. So this is the physical part. Homes burning down, people dying, firefighters dying, but also the lingering effect, the smoke, the smoke generated from these fires that are impacting these humongous populations in California and other large cities. These are some of the headlines after the fire. Wildfire smoke brings worst air quality to Northern California, or world's worst air quality to Northern California. So this is during this period of time, Northern California had worse air quality than Beijing, China, or New Delhi, or Mexico City. Some of these areas that you think of when you think of terrible air pollution. This was here in the United States. And then the smoke's gone, but hearts and lungs may still be in danger months after the wildfire. So, this is not just the folks that are impacted directly by the fires, but you're talking thousands, millions of people that are being exposed to elevated levels of air pollution over extended periods of time. Like I said, these fires are not going away. They are the amount of these large wildfires are increasing, and we're certainly seeing that here in Western Montana. Just every summer now, it seems like we are impacted by smoke, whereas even 10, 15 years ago, it wasn't like this. Here in Montana, we're expected to see increased temperatures, winter precipitation projected to decline, summer precipitation projected to decline, declines in snowpack and stream flows. And, experts are predicting that we'll see just a significant increase of acreage that's burned in the future by mid-century and by the end of the century. So as public health professionals, we are kind of gearing up for what to tell people, and in preparing that for smoke for our populations. This is kind of the new normal for us. Good news is that there's lots of things that there's proven technologies out there. There's a lot of great resources that are available, and I showed tons or several and with the links that are available to anybody. We're going to see more fires, but it impacts the outdoor air quality and perhaps more importantly the indoor quality. But these resources will help, and that they're important messages for fire managers that are interacting with communities. And I suppose prescribed burns and control burns are a useful tool, in addressing this issue in the future. And these are tools that might pertain to communities impacted by those events as well. And then, like I said, there's several interventions that have been proven that are successful, like these clean air rooms, using filtration units within your home, within your business, and just being aware is education is a really powerful thing. Folks know that now just because you're indoors doesn't mean that you're completely protected. So I think just knowing that, and especially for those susceptible populations, to be able to take those next steps to protect themselves, even if it's as extreme as leaving the area for a period of time. If that's what they need to do to stay healthy, then at least they know that that's what they have to do. So that's all I had, and I would be more than happy to take any questions from you guys. So thank you.
Awesome. Thank you so much. I can make myself visible again. Okay. Thank you so much for that presentation, Dr. Ward. Boy, so folks, please type your questions into the chat box. We had one question that came in sort of related to where you finished up. So with similar acreage and fuel type, has anyone done a comparison of PM 2.5 emissions or exposure from prescribed fire versus wildfire? Do you know of any studies that compare smoke effects of prescribed fire versus wildfire?
Are you talking about the health effects to populations, or just comparing different types of smoke?
I guess even the different types of smoke, yeah, of like PM 2.5 emissions.
Yeah, you know, I know studies that look at the chemistry of the different, you know, emission sources, but I'm not real familiar with studies that have looked at the different health impacts, like epidemiological studies. I'm just not familiar with what studies are out there that have, if there are any that are out there. So sorry, I can't answer that question.
That's all right. Yeah, it'd be interesting to think about how you could how someone could set that up, because a wildfire, you know, you can have, I guess you can have those monitors running in different places, and with a prescribed fire, presumably there's prescribed fire near Missoula, so it might be interesting to sort of compare data if you can. Of course, the winds are different and so forth, but
right.
Yeah. So again, folks, please type your questions into the chat box. I am sure that you guys have questions after that. There's a lot of great information. One thing is, as Dr. Ward and I were preparing, well, Dr. Ward did all the prep for this presentation. I mentioned that there are a lot of folks in the North Atlantic Fire Science Exchange that communicate with the public about smoke and about the impacts of smoke on communities. And so a lot of the info that you presented, this is really good information that we can share with people that we work with. And in addition, Inga sent the link to the PDF, so we should be able to access those links that you used in your presentation. So definitely check out the PDF if you want some direct access to those resources.
Yeah, if anybody has more questions, just shoot me an email too. I'd be happy to answer.
Yeah. All right, Joel has a question / comment. So Joel Carlson, who's a prescribed fire practitioner in southeastern Massachusetts, says, yes, on prescribed fire and wildfire emissions, there are some general studies that look at differences between wildfire and prescribed fire. I'm not aware of health directly. Prescribed fire most of the time burns less material and thus produces less emissions of the species associated with NAQS. It boils down to combustion efficiency and emission equations. RX 410 smoke management class covers this information in detail. So thank you, Joel, for sharing that. I haven't taken RX 410, but it sounds like I should. So very good to know. So the difference in the amount of fuel burned makes a difference. I guess on a related note, thinking about all the graphs you showed us that were multiple days of exposure, in a prescribed fire versus a wildfire setting, I guess there's a difference in the amount of fuel burned very often, but the amount of time. So I guess, how does time play a factor or play a role in exposure and exposure levels?
Yeah, so here in, just in Missoula, just personally speaking, when there's fires, prescribed burns and control burns, the guys that do it around here, they're the experts, and they look at the meteorological conditions, and it is pretty rare when they light a fire, a control burn, and they smoke out the community. It's only, I can think of one time in the last 10 years that's actually happened, and it was, just a freak storm that came through, or a wind event. But so we don't really have the exposures to control burns and prescribed burns like we do from forest fire smoke. And, during that time, it could be, days to weeks, to month and a half of just being in smoke. And when you're talking large, communities, as far as, firefighters and wildland firefighters, that, there's other studies that are focused more on that and looking at exposures of firefighters, that are, fighting wildland fires versus prescribed burns or control burns. So there's a whole bunch of studies looking at the concentrations that folks are being exposed to. As far as community-wide, we just don't see the exposures from controlled and prescribed fires like we do forest fire smokes or wildland fires.
Got it. Thank you. All right, again, folks out there, we have a few minutes more for questions, so please feel free to type them into the chat box. I'm sure someone out there is typing something right now. And if not, we also could unmute the lines, but we'll give folks another couple minutes to type into the chat box any questions that you may have. I'm thinking, Tony, on a related note, I guess the size of the fire, there's the size of a wildfire and the amount of smoke that would be produced by it. We in the Northeast, in the North Atlantic area, we haven't had any of the mega fires yet in recent history. However, even though our side of the country is only yellow and not red and orange, like on one of your earlier maps, we also, with climate change and other factors, have the ingredients for that. Are there messages or things that we should be trying to communicate to lawmakers, to politicians, to community leaders to prepare for smoke impacts from these kinds of events?
Yeah, I think, yeah, for sure, just bringing attention and educating the lawmakers on that this is an issue. It may not be a big problem right now, but just it's coming. And it could happen at any time. And then the other thing is this, a lot of times if it's burning in very urban areas, like we saw in California, it's not just, biomass smoke, it's burning houses, it's burning, all sorts of plastics and nasty stuff. So you're getting some really nasty chemicals that are associated with these downwind events too. And then, let's say you do have more fires, just that message of the indoor components, that just because you go indoors doesn't mean you're safe, and just providing those that second message that, okay, go indoors, but there's other things like having a filtration unit, or if you're really sick, you can have one of those masks and wear that inside. So I think that's a really important message, not only for the public, but also for the regulators and lawmakers.
Yeah, that's really helpful. And then, emergency management agencies as well, just right. Because we haven't dealt, with fires to that extent. We have other kinds of air quality issues in the densely populated Northeast corridor, but it's all really important to integrate and be aware of all these issues. So, people, I'm not seeing questions in the chat box, which I'm surprised by. I'm going to try opening up the phone line and see if I can see if folks have any questions you want to say out loud. So please mute your individual phone unless you have a question that you would like to ask. I'm going to unmute in 5, 4, 3, 2, 1.
For one day.
All right. So now we can hear anybody's background noise. If I hear too much, I will mute again.
30 people.
Does anybody out there have a question?
We do it on
does anybody out there have a question that they would like to ask?
Whatever the case is in a garage.
Amanda, this is Inga. This is kind of a dumb question, but I figured I'd ask it anyways. But for example, we're predicted to have more precipitation in the Northeast with climate change, as different from much of the rest of the country, although timing is kind of still up in the air seasonally. But what I'm wondering is, for example, if a fire is burning in one area and the smoke is impacting another area, and the rain comes in, where in the area where it's impacting, does that just immediately get all the particulate matter out of the air? Does that make sense? Like, it's just, does it automatically take everything out of the air?
Yeah, well, yeah, here, so anytime it rains, it just acts like a big scrubber. And you can look at, like the one graph that I showed, we had high levels of particulate matter in the air, and once it rained, it basically scrubs the atmosphere and the air that you breathe. And that's something that we also see during the winter, when we'll have a lot of smoke from residential wood stoves in our valley, and then it snows real hard and it really scrubs out the air, and it can actually be pretty clean air after these events. So yes, it does, once it rains, it does clean up the air. It's that that exposure that you had before it rains, that that's the one that I guess that causes the effect though. Does that answer your question?
Yes, thank you.
Awesome. Thank you. Yeah, we might have time for one more question. We'll give folks a moment. All right. So we're just 1 minute before the top of the hour. Please, everybody, virtually join me in thanking Dr. Tony Ward for his presentation on smoke effects on residential and community impact. We're really excited that you took the time to present to us today. Thanks again so much for taking the time, and thanks to everybody out there for joining us on this webinar. We did record it, and again, a PDF of the presentation is available on the North Atlantic Fire Science Exchange website. Stay tuned. In the month of February, we're going to be doing a presentation jointly with the Lake States Fire Science Consortium on spruce, grouse, and fire. Actually, the speakers from the University of Maine. So keep an eye out for that. But Dr. Ward, thank you so much for joining us today.
All right. Thank you, Amanda. Thanks for inviting me.
All right. Thanks, everybody. Take care.
Bye.